behavioral health, as everybody knows, includes substance use disorder. So I'm going to focus on describing the population and some of the challenges that I see moving forward. And I think I could do it better by using the PowerPoint. First, good morning to everyone. I'm extremely honored to have been invited to participate in this forum. It is indeed my pleasure to be here to honor this year's awardee and for your distinguished leadership and advocacy in behavioral health policy. Okay, so like I said, I'd like to talk about the substance abuse services and the importance of SUD, which is substance use disorder, being a full partner in healthcare reform, parity, and all other reform efforts. First, a little bit about the OASIS system. We serve over 250,000 people a year. About 110,000 are in treatment on any average day. This makes us one of the largest, if not the largest, treatment system in the country. The cost for our systems are $1.7 billion a year. This funding comes from a variety of sources, state general funds, federal block grants, and $870 million in Medicaid, Medicaid funding for fee-for-services in the cost of 2010. The problem with the fee-for-service model is that the system is uncoordinated and services lead to inefficient and ineffective care. I think it's important to also talk about addiction. It affects 2.5 million New Yorkers, including drugs, alcohol, and gambling. It is a chronic disease. It changes people. Science has demonstrated that drugs and alcohol use changes the brain. This requires people to make difficult, major changes in their behavior. We all know that a diabetic who hasn't monitored their diet as carefully as they need to, they relapse. The same thing holds true for the addiction population. The good news is that there are proven methods to prevent and treat this disease. Every day, millions of people are in recovery, surviving this disease. However, the prevention, treatment, and recovery services require special expertise. Just having mental health treatment training does not make one competent to treat addiction. We must ensure that treatment for substance use disorder is part of behavioral health. Substance use disorder services are covered under our parity laws, as we heard previously. For some, there is a primary addiction, but no major mental health or physical health problem. However, there are housing issues, vocational unemployment, hits our population very hard, family problems and other issues that they face. Many of our clients have other major health and mental health issues, liver disease, HIV/AIDS, heart and respiratory problems, as well as an aging drug use population. Seniors with substance abuse issues is a growing concern. On the mental health side, there is a continuum from relatively minor mood disorders to the very complex psychosis and schizophrenia. These populations need effective integrated care to help with these issues. The substance abuse providers must be equal partners to ensure the best care and outcome. Over the past 15 to 20 years, there have been major changes in working with the criminal justice clients. From drug courts to drug law reform, the move to address substance issues rather than incarcerate the addict has led to lower crime and reduction in prison population and the associated cost. But we still need to do more in that area. Our young people are the future. Increased use of heroin and prescription opiates, as well as the availability of designer drugs like spice, bath salts, are a major problem. We need to ensure there is an adequate and effective treatment continuum for our children, and we must include the family in what we do. Without the family support, there is little success in treatment. We are seeing many of our veterans returning from the wars in Iraq and Afghanistan experience problems with addiction as well. These brave men and women have sacrificed much to serve our country, and it is our responsibility to ensure that they get the substance abuse treatment services that they need. Such services need to be competent in treating the veterans, in particularly understanding the impact of traumatic brain injuries, TBIs, that affect so many. As I said previously, the current substance use disorder system consists of uncoordinated services from the individual patient perspective. For example, OASIS looked at all of the fee-for-service detox users in 2010. In particular, we wanted to look at the top 1,000 users in terms of cost. We broke them down into the top 100 and then the next 900. Together, these groups accounted for about 3.5% of the total group. When we looked at their costs and found that they accounted for 26% of the cost, that translates to $50 million. In fact, one individual in 2010 had 73 different detox admissions at 15 different facilities for 291 detox days, costing over $300,000 for one person in 1 year. And it is likely that this person is still overusing detox services today. We need a better system. It's very clear, right? A little humor, right? We have to change now. We risk just too much if we wait. So, but change is good. It is an opportunity. We can take our current inefficient, uncoordinated system and improve integration for people with multiple disabilities, including mental health, substance use disorders, and physical health. We have too many of our people leaving treatment before they really get started. If we improve retention, we will have better outcomes and reduce costs. We need to be accountable for our outcomes. Performance is important, and OASIS has several initiatives like the Gold Standard and the program report card seeking to enhance performance. If we focus on these issues, we will have a more efficient and effective system. The Affordable Care Act provides a sound foundation to make needed changes. There is increasing recognition that physical and behavioral health care, including specific substance use disorder services, need to be integrated. SAMHSA and other clearly define behavioral health as including both mental health and substance use disorders. However, progress has been slow. As a field, we know we cannot continue as we have in the past. The configuration of the system will no doubt change. It will not look the same from either a clinical or an administrative perspective. Nearly 5 million people are covered through public health, and what I will do now is just ask a question before I get into the numbers. What will be the impact of healthcare reform in New York State, specifically on the substance use disorder population? And what we'll see is that currently nearly 5 million New Yorkers are covered by public health insurance. Out of those, Medicaid insures 4.5 million people. Child Health Plus insures about 400,000 children. Over 10.5 million New Yorkers have employer-sponsored health insurance. 2.6 million New Yorkers are uninsured. 2.3 million are adults of those 2.6. from the ages of 19 to 64, and 343,000 are children. Now, the Congressional Budget Office estimates that 1.7 million New Yorkers will become insured through a public or private plan in 2004. In 2014, projections are that more than 500,000 New Yorkers will remain among the ranks of uninsured. That number is comprised of undocumented adult immigrants, low and moderate income New Yorkers who are ineligible for public coverage and exempt from the requirements to purchase coverage through the exchange, those who choose not to obtain coverage despite having to pay penalties, those who are Medicaid eligible but fail to enroll and remain uninsured. Many of these persons will also need substance use disorder and mental health services. How will this impact the substance use disorder system? With more people having insurance, they will have access to substance abuse services that wasn't available to them before, as we hope. The substance abuse population, for a variety of reasons, homelessness, failing to maintain Medicaid, being transient, etc., will continue to include many uninsured individuals. We need to ensure that we devote resources to help this population. To not do so only increases the risk to them and their families and increased costs to society in crime, healthcare, foster care, and other problems. Healthcare reform will also push us to be more accountable. We need to control cost. We need to improve effectiveness. New York State, with the Medicaid redesign team, is implementing initiatives like the BHOs and health homes to improve and integrate our services. There are three things that we need to ensure. One is that substance use disorder issues be treated on par with other behavioral health issues. Substance abuse affects all of our lives on a daily basis, whether it is ourselves or loved ones in the throes of addiction, decreased productivity in the workplace, a dangerous drunk driver on the highway, or the higher prices we pay to cover the cost to society. We are all affected. Addiction must be recognized as a critical issue, and the people who are the experts must participate in all discussions. Behavioral health care, including substance use disorders, must be given parity with primary care. Broader healthcare reform efforts frequently look at behavioral health as an afterthought. This must change, and that's my personal. The federal initiative to help fund an electronic health record excluded the behavioral health care system from participating. How can we possibly have an integrated health system that does not support data collection and exchange by the behavioral health care field? One solution to this issue is to revise current legislation. The Behavioral Health Information Technology Act of 2011, which was proposed by Senator Shelton Whitehouse last March, would expand eligibility for the Meaningful Use Incentive Program to include behavioral health care providers and professionals. We fully support this move to ensure equity for behavioral health and to promote true integration of services for the people that we serve. In closing, I would like to once again congratulate Dr. Glied on receiving this award today and voice my appreciation for the significant contributions she has made to advancing our issues in this field. I am confident that together we will make great strides and create a much better system that we have. Thank you.